Okay, let's talk about the glenohumeral joint and specifically the rotator cuff and deltoid muscles. So our first objective, describe the rotator cuff and deltoid muscles, including actions and innervations. Actually, that's the only objective. Okay, so there we've got a posterior view of the right rotator cuff, and there's four muscles: supraspinatus muscle, infraspinatus muscle, teres minor, and subscapularis muscles. We affectionately call these the sits muscles, even though it has nothing to do with your derriere. We call it the sits muscles because if you take the first letter of each of the words, SITS, there we got it. That's why they're called the sits muscles. Let's take the first S, which is supraspinatus. And in this view, we see the spine of the scapula, which is this continuation of the acromion, and then there's the greater tubercle of the humerus. Now, the supraspinatus muscle is located in that supraspinous fossa. Supra, above, spine, hence the name, supraspinatus, all on that supraspinous fossa. And look how it goes inferior or deep to the acromion and acromioclavicular joint, and then attaches to the greater tubercle of the humerus. Remember that going deep to the acromion, it can get pinched there. So their supraspinatus muscle in this anterior view in green, there we have our supraspinatus. When the muscle contracts, it'll help with abduction of the humerus in that fashion. But really, its biomechanical advantages are just in that first 15 degrees, getting to that point. In fact, there's the tension, and it usually keeps your arms just away from the body a little bit. Glenohumeral abduction, first 15 degrees. Now, the infraspinatus muscle is below the spine, but also attaches to the greater tubercle in this fashion. So there's our infraspinatus coming from the infraspinous fossa all the way to the greater tubercle on the posterior surface. And then there's our teres minor. We're going to do these two together, coming from the lateral margin of the scapula to that just below where the infraspinatus attaches to the greater tubercle. Looking at these two muscles, infraspinatus and teres minor, let's look at a superior view of the right shoulder. And there we've got our spine and the acromion and the greater tubercle. And then in purple, there's our infraspinatus, and in orange, there's our teres minor. So when these two muscles contract, they will externally rotate the humerus from this fashion to that fashion. Let's take a look at, so glenohumeral external, also known as lateral rotation. Let's look at it from a superior view. Those two muscles contract, external rotation, and then one more view. There's these two muscles. When they contract, they will externally rotate that glenohumeral joint. All right, so the subscapularis muscle gets its name because part of it attaches to the subscapular fossa. It's on the front, but you think of a quadruped like a dog that's on all fours. That subscapular fossa now is on the bottom, hence the prefix sub. And then another point is this lesser tubercle, which is smaller than the greater tubercle, and it's anteriorly located. And so the subscapularis arises from the subscapular fossa and inserts on that lesser tubercle. We take a look at the subscapularis muscle from a superior view, and there's the lesser tubercle, and coming from the subscapular fossa to the lesser tubercle is the subscapularis muscle. When it contracts, it will immediately rotate or internally rotate the glenohumeral joint. And looking from so glenohumeral internal, also known as medial rotation. From an anterior view, there's the motion. From here to there. Internal or medial rotation. All right, what is the common function? If we take, though, these four rotator cuff muscles, our sits muscles, and put them all together, what's their common function? Well, we see these muscles, let's build on it. So here's this right scapula from a posterior lateral view. We'll take the glenoid labrum and put that in position, and then put the humerus into position. And now let's wrap these muscles around this joint that makes a cuff that surround the posterior aspect of the glenohumeral joint, the superior aspect, and the anterior aspect. And so when they all come together, they will stabilize the glenohumeral joint as the humerus is moving around. These muscles form on the outside of the capsule, but they contract and basically try to pull and keep the head of the humerus in. Notice that they're not along the bottom. That's also another reason why the bottom is a little bit weaker. All right, looking at the supraspinatus and infraspinatus muscles and innervation, we add the brachial plexus. The nerve levels are from C5 and C6, where the motor neurons come together at the upper trunk or the superior trunk, and then the suprascapular nerve, which arises from the upper trunk, comes down, bringing C5 and C6 levels to send the first branch to innervate the supraspinatus, and then the suprascapular nerve continues around the spinoglenal notch and innervates the infraspinatus muscle below. All right, but what about the subscapularis muscle? It also is innervated by the C5 and C6 levels of the brachial plexus, and we have these motor neurons that come together to that upper trunk. But then also they continue down the posterior division and to the posterior cord. So if we follow this nerve route out, all the way out, the upper and lower subscapular, I said those in the wrong order, my apologies, lower subscapular and upper subscapular nerves innervating that subscapularis muscle. What about the teres minor? Hold that thought for a second. Now let's go to the deltoid muscle and actions and innervations. Okay, so the deltoid muscle, why does it get its name? Well, if we then take a scalpel and cut along the front and another and cut along the back, and we take and pull out from there the muscle, it looks like a triangle or the delta symbol, hence the name deltoid muscle. Now, the attachments of the deltoid are from the lateral third of the clavicle to the acromion, and then from the acromion all along the spine of the scapula, and then this muscle is going to insert right there on the deltoid tuberosity down the humerus. Because this muscle wraps around the front and back, we can divide this multi-pinnate muscle into different bellies. We have an anterior belly, we have middle belly, and the posterior belly. And the anterior belly is responsible for glenohumeral flexion. That middle belly is responsible for glenohumeral abduction, and the posterior belly is responsible for glenohumeral extension. So when we take a look at now the anterior deltoid muscle outlined there, when this muscle contracts, it's going to help flex the glenohumeral joint from this position to that position. So glenohumeral flexion. When we now look at the middle belly, here we draw this out, but what we're going to do to make this a little bit more simple is we're going to add, though, to see this, the scapula and the humerus, and then simplify the deltoid muscle. Now watch, when this deltoid contracts, the vector pull is straight up. So watch that green arrow showing that when the deltoid contracts, the humerus goes straight up and hits that acromial ligament, and it really doesn't have a biomechanical advantage to do a lot. So what we see we've got to do is then have the supraspinatus abduct first, now have the deltoid muscle contract to abduct the humerus at the glenohumeral joint. So real power of the deltoid is when your arm is already slightly abducted. Glenohumeral abduction. And then the posterior belly, when we draw that on, its action is going to extend the humerus, or glenohumeral extension. All right, so now what is the innervation of the deltoid and the teres minor? Well, we take a look at the C5 and C6 as well, and those motor neurons come down to the upper trunk, and then they continue down the posterior division, and then to the posterior cord, and the key to it is that axillary nerve. So watch all these motor neurons come out and send innervation to both the deltoid and the teres minor muscle. So there we have our rotator cuff muscles and their innervation, and the deltoid muscle and its innervation.